Claire, let me start you off in the discussion. So you got a patient coming into your clinic or you're consulted in the hospital, and she's got pretty severe critical limb ischemia. So what are the things that are going through your head as you kind of meet her and think about taking care of her?
Well, first, in setting just a goal for the interaction, you know, the goal of all of the interventions that we do are really to, save the limb, salvage their function and their ability to engage in the kind of activities and quality of life that they want to. And in order to do that, from my perspective, it really has to be approached very holistically. You can't focus solely on the wound or the limb at hand without also taking into account all of the factors that have brought them to that critical point in their lives and in the end stage of this bad disease. So some of those things include behavioral habits. If someone has been a smoker for a long time, also a lot of their understanding and education around their medical problems. So, for example, do they understand sort of the role that their diabetes or their high blood pressure might be playing in sort of the worsening of their condition? And I think it's very important to sort of weave these things together. What the patient is coming in with as far as their history, what their limb currently looks like, and what kind of goals for quality of life and function we can hope to achieve with intervention.
Yeah, I think that's exactly right. It's been a little bit of a frustrating course over time in one sense because we have not had a lot of medical therapy to treat peripheral arterial disease. That's changing a little bit. Some good trials that we might touch on a little bit later have shown some promise.